But the leader adjusts the sails, and true leaders adapt. It's from somebody called John Maxwell. It's a very good quote.
Very good.
Thank you.
Nice, very nice quote. Thank you, Jack. Thank you. It's really true. I completely agree. Totally agree. Maybe Professor Kazadi is come back, no?
Kazadi,
Yes, I'm here.
Are you ready and able and willing?
I'm ready. I hope technology will be on my side.
Okay, let's go then. Let's give it a go, Kazadi. Is there any other?
Try. Let's cross the fingers.
Okay, we're crossing the fingers, Kazadi, for you. Let's go.
Good. Okay, I'm going to share my slide. Can you see that?
Yes, we do. Oh. And you go on to presentation mode.
Let me put it on the.
If it doesn't move, then we'll just.
Okay, here we are. I'm putting it on presentation mode.
There you go.
Yeah. That's okay?
Yes, you just.
That's great.
You did whatever you needed. Great job.
Again, thank you very much for your presentation, and thank you for Najaf and the team for organizing such a wonderful and fantastic seminar. We still have on our heart our departed friends who were actually part of our family, and I think particularly about Suad, whom I knew very well, and of course Professor Tetsuo Kano. So they are all part of our family. Okay, you see the slides are changing.
Yes, they're going. Yes.
Excellent. So that's my talk: challenges to practice neurosurgery with minimal resources, and what are the tricks to succeed. Okay, I don't stay on that. You know, all of you where is Zimbabwe, and this is our medical school. And I would like just to show you that having traveled a lot in Africa, those blue zones, I went on those countries and I saw a certain pattern which was common to many African countries. And also I traveled a bit in the world with the WFNS teaching program. And these helped me to understand a bit better, not everything, of course. What are the type of challenges a young neurosurgeon can face? First of all, we talk about the definition of developing country or third world country. We'll come to that because it's very important that particular position. Then I will talk about not really my personal experience, because then we don't have enough time to talk about that. There is a problem when you come back to Africa in general, or you come to your own country, having trained in Africa, but coming back to your own country, it can be also a challenge. And you have to be accepted as a neurosurgeon. It's not automatic. You come and say, I'm a neurosurgeon, but it's not automatic, because before you, there were general surgeons who were doing something, and they don't understand what are you going to bring as a new technology. Then you have to build the neurosurgical team and change some habits, because neurosurgery nursing is completely different from a general nursing. And then, of course, the problem of equipment, relationship with the authority, by those decision makers. There are also other challenges, neurosurgical techniques, the research, and also the influence of traditional medicine. In Africa, we have also what we call traditional healers who have got a lot of influence in treating patients. Then we talk about continuous education. You need also to train, to think about training young doctors, young neurosurgeons, because we don't have enough in many countries, many African countries. And of course, you would like also to contribute to the world, which is very important with your research. Now, I come to the definition of third world country. You see there are so many definitions, developing country is country without an industrialization, or per capita income of whatever. And developing country are countries who are needing help, and so on and so forth. You see, sir, there are so many definitions, yet it sounds so easy. But the important thing to remember is that once you are categorized as emerging or third world country or developed country, you are put actually into a box. And if you're not careful, you'll stay in that box, not thinking about coming out of the box. So all those words, they should be actually cancelled, and saying, maybe I'm in an emerging country, but I'm for the moment in an emerging country. So the situation is not a permanent situation. So one has to think as a person who would like to go out of that box. There is also this famous picture where they will say, where there is not enough light, that's a third world country, that's a developing country. Okay. Now, but we should also look, what are the real challenges in economically challenged countries? When you see that patients have to travel long distances to get treatment, that's a problem. And when patients they come mostly with a gross and sometimes incurable pathologies. Other patients are, even when they come, they are unable to afford the treatment offered. And other patients, you treat them, but they go back and go into the same habits. And about neurosurgical integration, when you come as a neurosurgeon, there's been somebody who was doing something. That's why they call themselves general surgeons, because they do everything. And they think the few holes they did in neurosurgery, they're doing neurosurgery. So when you come, they look at you as somebody who is arrogant. What are you going to bring? Okay. We used to do macrosurgery and the trauma and so on. I think these pathologies have changed a lot, and we know that we see exactly the same pathologies as in what you call developed or industrialized countries. What a young neurosurgeon should know is that when you bring a new technology in these particular circumstances, you are bringing neurosurgery. You bring a pain because you are going to disturb the comfort zone of many people. And psychologically, psychologists have done studies, they show that human beings, they move towards pleasure, but only for 30% or 40%, but they run away from pain in 60 or 70%. Okay. So whether you are African or non-African or from other countries, you'll have problems because you are bringing something new habits, new philosophy, new technology. Okay. Sometimes this is also can be a problem. You train an English-speaking country and you come to a French-speaking country, you might have problems. And these problems can be accounted. We know even countries which are bilingual, like Cameroon, they're coming in a different speaking, the area where they speak another language. So what I tell the youngsters that when you come, you do what they are doing with whatever available equipment. Don't go into complicated surgery. But when you do it better because you're a neurosurgeon. They're just general surgeons, or they can be whatever, maybe just GPs, but who have learned to do a bit of bell holes. You'll do it certainly much better. It's important to learn the language of the patient because that's the way you're going to get the diagnosis. Okay. You see, for example, in Zimbabwe, they were saying there are no aneurysm, but the problem is the word sudden doesn't exist in the local languages. So we had to find a way of explaining what it means sudden. And once you've done a few cases, you go and present them. Generally, if you have 5 or 6 cases, you present them. Then people start to realize that you are really the leader. There is also a human challenge. Nurses are not specialized, they are polyvalent. And you have to be there most of the time. You have to change the habits and do some things yourself. In ICU, you need to know how to suction the ET tube, and in the ward, you have to teach the nurses how to turn patients, how to do this. Very important. Okay. And the nurse, generally, they know maybe 20% of the neurosurgical instruments. You have to be there to help them. And you have to have a checklist. You come a day before, you check all the instruments, and during the operation, you have to do it phase by phase. You start with the first session, session, and then progressively you prepare the instruments and you go step by step. That's the only way you can succeed. And you, as a neurosurgeon, during the training, it's very important that we broaden the knowledge. You have to be capable of doing transthoracic approach to the T-spine. You have to do a bit of maxillofacial surgery so that in our program, they go through those specialties so that they learn how, because when you have a head injury, you can have also fascial injury. If there is a maxillofacial surgeon, that's fine, so that you call the colleague to learn together. But most of the time, if you're outside the major centers, you have to do those things on your own. About the equipment, you start with the available equipment. I heard Claire, who did it very well, started with what was there, and you do with what you have. You can manufacture some equipment. I'll show you a few things, we've been doing. Okay, particularly those things, we use and then we send, we throw away. It's very important to be able to manufacture them. And you have to be able to run all the equipment, not to wait for the technician. We don't have a technician, so you have to learn how to do them. And when there is a technician coming to repair an equipment, go there and watch, because most of the time those faults, they repeat themselves, so that you know how to repair it. Okay. And it's also important to know that you have to adapt the surgical technique to available resources. There is no point to do something very sophisticated when you don't have the capacity. This picture shows you some of the patties we use, the cotonoid. The cotonoid is the patty. This is a commercial one which we found everywhere. But those two which we manufacture ourselves in theater, they work as well. Here you see one of the pathologies which is very common in Africa, hydrocephalus. And we invented a shunt, which we called Harare shunt. It's just a tube of silicone. It's a split shunt, and we connect here. This is a ventricular part, and it has been working very well. In fact, the real cost was $2. But when we started to tell people to pay just $2, they didn't trust the shunt. So we had to increase the price to $20. Then they started to buy it. So it became more acceptable. Now, about the political challenge, it means the relationship with the authority. First of all, you need to have clear ideas of your needs and have a list always ready, because the moment you speak to a minister, they will ask you, give me a list. The list has to be ready. And when you speak to the minister, speak in layman language, because it's not because you are a minister that you know everything. It's us. If one of us become a minister of industry and so on, we don't know all those things. So you need to understand. And also there is a neuropsychological technique where when you speak to the minister, if the minister speaks slowly and things like that, don't come and speak so fast. Speak slowly. You have to mirror his position. You have to mirror also the tone of his voice. You have to use his own vocabulary and always smile. Okay. Of course, the first time you won't get everything. You'll be thrown out of the door, but you come back from the window. You have to come back sometimes 6 times. You keep smiling, you show determination, you improve your argument, economy, patient's benefit, minister's personal success, safety for VIPs, and so on. So you have to keep lobbying. We, doctors in general, we are too polite. Once you say once, we think that's enough. No, we have to keep lobbying, because the moment you leave the office of the minister, somebody else will come in and talk about diarrhea, another one will talk about malaria, another one will talk about this and so on. But if you come regularly and show that this is important, that's how you get something. So keep in mind the word lobbying. Research, it is always possible. Money is not a barrier. You start first by solving local problems. Okay. Naja just spoke about the study they did. I saw that study when I went to Morocco on the exchange program about study of to see whether the aneurysm were present, in Moroccan patients. So this is something which was possible, and it didn't require a lot of money. It's also important to study epidemiology and be bold to write a paper, because it can interest somebody. And look here. We actually presented this paper, and it had a lot of success. It's a bilage of the spinal cord. It's very rare, but some people actually wrote to me from elsewhere because they had a patient who had this kind of symptoms, and I solved them for them. Okay. We did also another paper on how to remove tumor, intramedullary tumor, without cavitron by using a technique on the 2 stages technique. And we did a paper, Essene spoke about it, and I'm not going to go into that. So it's impossible to do. Okay, there are other papers, maybe they're not relevant for developed countries, but for us, cavernous sinus thrombosis is a serious condition. 90% of Japan used to die until we discovered that by doing some studies that this is a child, by doing some studies, we realized that those patients, they develop also raised intracranial pressure. And by treating also the raised intracranial pressure, we managed to save these patients. Okay, you see the development and the network of the veins, which explain why they have these raised intracranial pressure. The training, using our own resources, we trained quite a number of doctors from neighboring countries, and of course from Zimbabwe as well. Here some courses were participated. Here we are in Senegal, and here we are in Nigeria. So the continuing education for a young neurosurgeon, one should save at least 10% of the income, your income, for further. First of all, you have to think about your pension. It's very important also. This is a subject. I gave a talk on monetary, how to invest, and so on and so forth. This could be discussed further on, later on. On your own education, investment in equipment and consumable is very important. You can buy books. Nowadays, you can have actually books which are electronic books. And it's very important to subscribe some magazines. Those also, if you talk to other people, you can have access to a number of magazines. And of course, visit colleagues in the theater so that you can learn. And nowadays, there are also online availability of a lot of things one can learn. It's important to keep in mind that you have to keep learning. Now, we also face in Africa what you call traditional medicine. It's a reality, and it's good to understand that. They have their own way of thinking. I was particularly interested by the tattoos in low back pain, and the sciatica. It's very interesting that those traditional healers, they never went to school, but very precise in the way they do the tattoos. And when you see that 76% when you did the study of patients coming from back, coming to our outpatient clinic because of backache, they have traditional healers tattoos, 60%. So it's very important. You see here, the tattoos, there they go, okay? And on the leg, you see here, they go to the small toe. And on this patient, when you do MRI, he had exactly what was happening in this patient. So it's very important you cannot neglect them. Here we see a patient who had the low back pain. Very interesting is that you see those tattoos are recent, but you can see that there are other tattoos which are old. It means this patient has been having a chronic backache, followed by some recent backache when we saw this patient. So it's very important. Of course, you will ask to the patient what was happening, but just by watching the tattoos, you'll know what has happened to the patient. You see this patient had TB of the spine for quite some months, and this is the reason why he had those tattoos. My conclusion is, working in developing countries, you have to be polyvalent. It means you have to know more than the usual knowledge which is required in developed countries. It's like in the army commandos, they can fight any war. Working in developed country can be exciting, but you must know the rules of the game. You have to be in charge. If you believe you can, you are right. But if you believe you cannot, you are also right. So you have to choose. That's your choice. Developing country is a state of the mind. That's very important. A way of thinking, which you can keep or by yourself, or other people can be sustained at your mind. Thinking developing country, it means remaining developing country. It means stagnation. But if you change the way you think, then you'll be progressing towards your development or your first world. And we need to remember that my first world, it doesn't necessarily the same first world for somebody who is living where they have everything. So each individual on earth has his own and the unique first world. The important thing is what? Is to change from this status for a better status, and then the other one, and so on and so forth. One can be modern, not just to be modern, but for efficiency with appropriate equipments. So those are operations we did. I'm not going to go into that because we don't have a lot of time. Those are our equipment, the ward, the team. Okay, I think I stop here, and thank you so much for your patience. Sorry for the fact that, the technology was a bit difficult. Thank you very much.
Thank you very much, Kazadi. I'm sure for those young minds who are in training or have just come back from training, wondering how am I going to succeed, just like the lecture of Claire, you've given an overview that I'm sure is enlightening and inspiring to those who really might feel at a loss after having trained for so many years, coming back and then wondering how to go about settling themselves and doing what they need to do. Thank you very much for bringing overview and bringing us all down to the basics of how we need to succeed. Thank you. Are there any comments to Kazadi's talk before I hand over to Fahad to take over?
Thanks to Kazadi for this excellent talks, and especially for young neurosurgeon as Moody emphasized, because of course, when they come back, sometimes it's very difficult, and you are the proof that everything is possible. You show us what do you call it? It's the shunt of Zimbabwe, Harare shunt. It's still working till now, Kazadi? You use it till now?
It's very interesting. Before we had the Harare shunt, we had many friends, from developed countries promising us to give us shunts, but they never came. So the moment we started to make our own shunts, we received so many shunts, So you see, the moment you start to do your own things, you see that you start to receive our things. But we still have our laboratory and we still have our technology.
Okay, thank you.
Great. Anything else? Anyone?
May I say some words about the last talk? Thank you, Professor Kazadi, for your talk. I remember you presented the talk in 1994 in the first Maghreban Congress of Neurosurgery, which was held in Rabat 27 years ago, and you presented your talk about the cavitron of the poor, low income countries. So you presented your, I think the series you published in Surgical Neurology in 1996. But you presented some cases operated in stage 4 intramedullary tumors, and you are still doing the same, and your philosophy is still you have still the same philosophy, combined by this philosophy, your rights to work in so, because this is the only manner to overcome these difficulties in low-income countries in the beginning of practicing neurosurgery. Thank you.
Thank you very much.
Any other views, comments?
Yeah, just maybe you hear me?
Yes.
Yeah, just to say thank you to Kazadi and to tell him to confirm that he has really given the picture, the real picture of the pioneer neurosurgeons in Africa. But I think not only in Africa, that was the same also everywhere in the world. So thank you so much, Kazadi.
Thank you very much, Abdeslam. Thank you.
Okay, it's my pleasure to hand you back, everyone, to Fahad, who will do the necessary to bring this wonderful conference to its conclusion. Fahad, over to you. Thank you for making me a chairman.
Thank you so much. I am just amazed by this wonderful session. So I think we reached the end of our 2 days meeting, and before giving the mic to Professor Jack Morcos and then to Professor Naji Abedi to conclude, I want to just share with you some numbers, some information about the meeting. we have this wonderful meeting for 2 days with a lot of conferences in different topics. We have a wonderful discussion and a lot of idea and visionary advices for neurosurgeons, especially young neurosurgeon. And 60 and 85 participants from 18 countries enjoyed talks of and the discussion of 45 faculty that I wanna thank for their participation. They spent 2 days with us. Thank you so much for presenting your societies, the AANS, the CAANS, the PANS, but also other countries and societies and continents. Thank you for your participation. And I want to thank also all the participants for spending these 2 days with us and for their compliments, for their questions. And they will receive their certificate during this weekend. Thank you so much. And the mic is yours, Professor Jacques Marcus.
Very briefly, it's been a pleasure to see each other since COVID is still stopping us from mostly seeing each other in person. I thank Najia for the idea of doing this on behalf of Reggie Hay, the AANS president, the entire AANS. I'd like to thank our AANS members such as Bob Dempsey, Jeremiah, Gail, Rick, and all the others that participated. I thank all the other speakers from Pan Arab, from CAANS. It is wonderful to see again that the world remains flat and united in spite of this deadly virus. It's wonderful to be able to hear each other, to hear different ideas about same topics. This is what makes, I think, human life worth living, to be honest. And I pass the microphone to Najia. Najia, all yours to conclude.
Okay, thank you so much, dear Jack, for your great collaboration and close. We are always working together with a great pleasure. So if you allow me, I would just summarize briefly in a few minutes what happened during these 2 days. Wait. Okay. So we had the first day a great introduction and homage to our late Bakhti, and of course the first the welcome made to the meeting by Jack Mahmoud Qureshi as president of CAANS and myself. And the first session was very interesting. It was about vascular surgery. We had many friends from USA, Mustafa Baskaya, and our friend from Senegal with his this great job that he is doing. And especially I am very it's very amazing when we saw Samir Hoz show us what he are doing with of course aneurysm ruptured. And Yuko Kato, we know that she's a great specialist on neurovascular, but she gave us a special talk about the wall pathology of this aneurysm. The session, this is a second session, is about skull base. It started by our friend, Professor William Caldwell, who has given us many advices and the learning curve for a skull-based surgery tumor, especially for not only for young, but only for the seniors, because this, and I enjoy very much this image with the difference between the microscope and the endoscope. Professor Abdsalam Khamnishi gave us an amazing talk as usual, especially how we can take in charge the giant tumor. Is a very great challenge. It's still a challenge for us. And our friend Ahmed, he gave an outstanding talk as usual. Francesco Tomasello, my dear Francesco Tomasello, we enjoyed very much also your wonderful talk, microsurgery removal of third ventricle tumors, and how you was emotional about our friend Suad. The session first Thursday is dedicated to spine. We had with us Professor Christopher Shaffrey. He's one of the giant spine surgeon. And of course, the comeback of Professor Jacques Rothschild, President Honorary of WFNS, who is specialized, the great specialist in the spinal cord tumors. And of course, our friend Abdurrahman Sidi Said, Professor Abdurrahman Sidi Said from Algeria, giving a brief homage to our sisters. Professor Abdelhafid Shihabuddin, you know him very well. He's from Egypt, and he gave a really wonderful talk about minimally invasive surgery and amazing talk about our Jeff. Especially, I was really astonished by this technique on doing her. His talk, amazing talk about that. And the session number 5 was a session dedicated to young neurosurgeon. They are all the 4 speakers are amazing. They give the wonderful talk, very interesting and very inspiring. Ignatius, Fahd, Federico Nicolsi. And the last session is about workforce of the future in neurosurgery. And we start off with another giant neurosurgeon, Professor Robert Dempsey. Thank you so much for being with us and sharing with us your knowledge, and especially your dedication and your devotion to African neurosurgery. André Grothaus, we know that you are the friend of not only the African, but I think you are the friend of all the neurosurgeons, especially more closer than for the neurosurgeon from the low and LMIC than high income countries. But we enjoy your talk really very much. As usual, thank you, Andre, to really spend 2 days, 2 full days with us. Salman Sharif, he gave us what happened during this COVID-19, especially about the different webinars, and we know that he is one of the pioneer in this webinar when this crisis started. Graham, you are our friend, and you touch me personally with the photography that you've shown us about Suad and his family, and really your talk inspiring all the neurosurgeon. What can a neurosurgeon do for you? This is a question that we need to ask ourselves every day. And finally, my dear Kazadi, and with the Professor Hamnishi say that you are a pioneer, and it's true. And the pioneer in Africa with the lower income is very difficult, and we know we have to adapt ourselves to adjust ourselves to the context. So thank you so much for all the speakers, all the chairman and the moderator and the participants, especially, and as the number that Fahd shown us, more than 600 participants. It's, I think, one of the most meeting which was following by the neurosurgeons. Thank you, and I hope that we will see you next time in person, not only virtually. And finally, I would like to thank again my dear friend Jack for organizing this meeting with me. Thanks a lot, and special thanks for our Fahd, because he are doing everything. He co-moderates, of course, of these 2 days, but you know, of course, but behind the 2 days, there are the great job that he's doing for more than 2-3 months. And we end by thanks our sponsors to permit us to be all of us today here. Thank you so much, and I hope see you soon.
Bye-bye.
Thank you very much, Nadia, and all. Fantastic 2 days.
Thank you.